House now. South Carolina is one of just 10 states that have not expanded Medicaid coverage under the Affordable Care Act.
But now a new study says that the state would generate billions more in economic output a year if the state chose to expand Medicaid. Josie Frost is at the State House with more on how that study and the health care debate continues.
A proviso that was vetoed this year in the South Carolina state budget would have created a committee to look at exactly this, healthcare reforms, including expanding Medicaid. Now, this report shows Medicaid expansion could bring in billions of dollars of federal funding, as well as extra tax revenue. But the governor says he's still unconvinced.
This is about helping people stay employed.
Sue Berkowitz is with the South Carolina Appleseed Legal Justice Center. She says expanding Medicaid would have the biggest impact on those in the coverage gap. These are people that are below the poverty line but still make too much to qualify for Medicaid in the state. Expanding Medicaid qualification would change that.
What it means is if you're able to take care of your health care and you're able to stay healthy, it means an overall improvement in quality of life, and you're able to succeed.
Now, a new report from Cover SC says that expanding Medicaid wouldn't just benefit those individuals, but the state economy as well. Cover SC Chair Teresa Arnold says that the federal government would cover 90% of the cost of expansion. South Carolina would get an extra $8 billion in federal matching funds from the government.
Really and truly, it all boils down to it's a really good investment. If I learned that put up $1, somebody else would put up $9, and I would get something cool at the end of it, I'd be extremely excited about that.
The report also says that would create an extra 29,000 jobs and $345 million in tax revenue over the first 3 years. But the governor remains unconvinced. He vetoed a study that would have looked into Medicaid expansion, among other avenues for health care reforms. In a statement to News 19, a spokesperson for the governor said special interest groups have been issuing reports like this for years, claiming that billions in new spending for Medicaid expansion will create new jobs and prosperity. The spokesperson for the governor also said Medicaid expansion would cost the state over $300 million a year. That's more than some state agencies got last year altogether. Reporting at the State House, Josie Frost, News 19, WLTX.
That report also breaks down Medicaid expansion in each county and says it would have extra impacts on smaller counties. Sumter and Orangeburg counties would see more than 6,000 Medicaid beneficiaries in each county. That report says each of those counties would also get an extra 700 jobs.